one of the biggest fears in the mind of dental student is teeth arrangement. और हो भी क्यों ना, शुरुआत में एक एक दांत सही से लगाने में हफ्तों लग जाते हैं. So if you too are fed up of running back and forth to the teachers for your teeth arrangement approval and want to learn the right way, do watch this video till the end because here I will be covering an in-depth demonstration of the same.
Hi, this is Hina, the voice behind Dr. Teeth. Why smash your head in your textbook when we are here to make dentistry easy for you? So before we proceed to the video, don't forget to smash that subscribe button, and also if you found the video helpful, don't forget to like and comment as it motivates us to create more videos of this kind. For more amazing content, don't forget to visit our website where we have MCQs, courses and much more. So let's begin.
Hello everyone, Assalamu alaikum. I hope you all are doing fine. Welcome back to Dr. Teeth. I am Dr. Hina and I make dental videos with an intention to help dental students. So if you like my efforts, please do subscribe, share and comment as the numbers will motivate me to create more content of this kind. Before we begin the teeth arrangement, it is mandatory for us to know what we are aiming to achieve. And not just know, but have a very clear picture of it in our mind before we even start. This mental picture will help us get closer to perfection. How? By comparing the picture we already have in our mind with our work and rectifying the mistakes. So in this demonstration, I will be trying my best to create a mental picture that you can always imagine and do your teeth setting so that you get it right. कमेंट सेक्शन में मुझे ज़रूर बताइएगा अगर मैं ऐसा करने में कामयाब हुई. In English, do let me know in the comment section below if I am able to create that mental picture in your mind. Remember, we had marked the midline of the rim, right? And we start by placing the maxillary central incisor. Now, each of these teeth will have to be placed keeping in mind three views: the facial view, the proximal view, and the occlusal view. Now, what all can you see from the facial view? Let us imagine. From the facial view means from the front of the rim, we will be able to see if the teeth is at occlusal plane or little above the occlusal plane or little below the occlusal plane, right? Also from the facial view, we will be able to see if the long axis of the crown is parallel to the midline, right? Or if it is tilted either distally or mesially. Okay? From the proximal view means if we look either from the mesial side or from the distal side, we can check the proclination or retroclination. Means we can check whether our teeth is proclined, means little forwardly placed, or retroclined, means little inwardly placed. Now finally from the occlusal view, we will be able to see the arch form, means the arch form the teeth makes by tilting them, okay? And again their position. Starting with the anterior-posterior placement, means whether the teeth is proclined, retroclined, and if it is proclined, how much proclined, okay? Now, it is important that the artificial teeth are in the same position as the natural teeth. So, for the maxillary anterior teeth, this position, this natural position is slightly proclined depending on the arch form. Now, how do we determine how much proclination does the teeth have? Now, one way is that we can consider the incisive papilla. We'll pass a line from the center of the incisive papilla and one line from the labial surface of the incisor. Now, this distance, the distance between the center of the incisive papilla to the labial surface of the central incisor, it should be of a certain amount, and this varies according to the arch form. For square arch, it is 5 mm, for ovoid arch, it is 6 mm, and for tapering arch, this distance is 7 mm. Generally, the maxillary anterior falls on the sulcus of the mandibular anterior. Now, one problem we face while teeth setting is due to ridge resorption. We all know that we have ridge resorption in edentulous patient. So because of that ridge resorption, the tooth we arrange, it tends to occupy on the ridge position. Now this has to be avoided. This will not provide the proper lip support. This will not be aesthetic and also not be good for phonetics of the patient. Okay, so without going into more details, I should realize that this is a demonstration video, not a full-fledged lecture videos. I'll probably create a more theoretical oriented video on this topic, but for now I think this is sufficient. Let us start with the demonstration. We'll heat up our wax knife and scoop out the wax roughly equal to the dimensions of the tooth. Now, first of all, place the central incisor roughly in the position and we'll adjust it. So we have placed the central incisor. Now let us look at it from the facial view. What all can we see? The tip of the CI. The tip of the CI, it should touch the occlusal plate. Remember. Now secondly, since this is an ideal rim and it has a square arch form, the central incisor should be straight, means the long axis of the central incisor should be parallel to the midline. Now this varies with the arch form and can be seen in this diagram here. Here you can see that depending on the type of the arch form, the inclination of the central incisor is differing. Okay, in case of the ovoid arch form, it is slightly tilted distally at the neck, while in the square tapering or the tapering, it is more tilted distally. The neck is more distally, right? So depending on the arch form, we have to align the long axis of the central incisor from the facial side. Now let us check from the lateral side. Now from the lateral side, there should be slight proclination as determined by the distance between the incisive papilla and the labial surface of the teeth as already told. Or another way, that the upper teeth should fall in the sulcus of the lower teeth. Now from the occlusal view, we can appreciate that the incisal edges will follow the arch form. Now the tooth positioning can be modified to give certain visual effects. Like if you put the central incisors this way, they'll appear normal. But if distally they are tilted, they will appear small. And if they are placed straight, they will appear larger and will give an effect of boldness and strength. So in the male patient, you can arrange the central incisor straight. Coming to the lateral incisor, let us place the lateral incisor by the same process. Scoop out the wax and place roughly the lateral incisor. Now from the facial view, what all we have to check, first of all, it has to be 0.5 to 1 mm short of the occlusal plane. The neck will be tilted distally, means in this case the long axis of the tooth will not be parallel to the midline, right? It is tilted distally at the neck. Also the neck is slightly depressed, so we put a little pressure on the neck area to depress it, right? And after we do that, we adjust the incisal edge so that they are in line with the central incisor. Now when we look at it from the proximal view, since the neck is depressed, it appears more proclined. Though it should not be ahead of central incisor, it should be in line with the central incisor following the arch form, okay? From the occlusal view, the mesial incisal edge of the lateral incisor should be in line with the distal incisal edge. Also, it should follow the arch form, okay? The next one is the canine. Again, do the same process. Scoop out the wax and place it roughly. Now, when you have that imagination in your mind after watching the video, you will be able to place the canine in almost the correct position in the first go itself. But since I am just demonstrating it for the first time, I am just saying that keep it roughly. But if you have the knowledge already, which you will get after watching this video, obviously you will be able to keep it in the almost correct position. Now from the facial view, the tip should be touching the occlusal plate. The long axis of the tooth should be parallel to the midline, or the neck can be slightly distally. Also note that the neck should be prominent, means the neck should be little outward compared to the tip. Now from the facial view, you should be able to see only the mesiolabial portion of the tooth. Rest of it will be hidden from the front view. Remember that. Now from the proximal view, we can appreciate almost vertical long axis of the position of the canine. An occlusal view, it follows the arch form and placed at the corner of the rim or arch. Now here, the mesial cusp slope is in line with the distal incisal edge of the lateral incisor. If we draw a line from the canine tip to the other canine tip, or just a straight line from the canine tip towards the other side, it will pass through the distal border of the incisive papilla. So this is also an important thing to keep in mind. Now we are done with the teeth arrangement of the maxillary anteriors. Now let's move on to the mandibular anteriors. Okay, so here we can heat up the rim so that it becomes moldable, and we can fix the teeth, the central incisor. Now if you look at the central incisor from the facial view, you can see that the long axis of the teeth is parallel to the vertical axis or the midline. Now if we see the central incisor, we can appreciate that the long axis of this tooth is parallel to the midline or the vertical axis. Here the incisal edge will be 1 or 2 mm above the occlusal plane, obviously because we need that overbite. The normal overbite is 2 to 3 mm, so we are free to achieve that by doing this, by placing it 1 to 2 mm above the occlusal plane. Now from the proximal side, the neck will be depressed and it will have a slight labial inclination. If we look from the occlusal surface, both the right and the left central incisor will be in a straight line. Coming to the lateral incisor, from the facial side, the long axis inclines distally at the neck, as we can see here. And again, the incisal edge will be 1 to 2 mm above the occlusal plane. Proximally, the long axis will slope labially, but not as much as the central incisor, little less than that. And from the occlusal view, we can see that it follows the curvature of the rim. Now at this level, check the overjet and overbite. The normal is 2 to 3 mm for class 1. Now coming to the canine from the facial side, we can see it has more distal inclination at the neck, and it is also 1 to 2 mm above the occlusal plane. Proximally, we can see that the neck is a bit prominent, making the long axis a bit lingually. The neck is a bit prominent and the tip is little lingually. It is going inside. It seems like it's going inside. And from the occlusal view, we can see that the canine falls at the corner of the arch, and also it follows the arch form. We remove the unwanted wax by heating the area with a chip blower and using a sharp pointed instrument like a lacron carver or the pointed end of a wax spoon. So this is our anterior teeth arrangement, and since you're here at the end of the video, I am hopeful that you liked my hard work in creating this demonstration, and if you did, please don't forget to subscribe, like, comment and share, because the numbers motivates me to create more videos of this kind. Also, let me know in the comment section below if you want me to post the demonstration of posterior teeth setting in the near future. With that said, I am signing off to meet you in the next video. Allah Hafiz. गला खराब हो गया बोलते बोलते